Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast. Today we're going to talk about the neurological disorder by the name Parkinson's. Okay, Parkinson's is the word which was coined in the year 1817, 1817 AD. In UK, a very famous doctor in the year 1817 published a very big article. Those days, journals were not there. So in a newsprint, he published a very big article about this neurological problem. He has explained all the symptoms of people who are suffering with the nervous part of our function, and made a big article and published it in the year 1817. And he has also requested this should be considered as a neurological disorder and this should be considered as a neurological disease. That was his request at that year of 1817. This man's name was James Parkinson's. So since he was the first medical practitioner who published this article, writing very long details of this neurological problem, his name, the second name called Parkinson, was named after this disease. This is the history of Parkinson's. Ever since 1817, in modern science, we've been studying about Parkinson's. Unfortunately, we don't have a total cure for it. We have a few maintenance drugs for this, especially trying to equate the dopamine. They normally study the certain part of the human brain cells produce dopamine for its function. So dopamine, when the production of dopamine, when it is reduced, it leads to a lot of neurological functional drawbacks. So which leads to a lot of other symptoms. And about symptoms of Parkinson's. There's a website by the name parkinsons.org. You can go and study innumerable number of details of Parkinson's by yourself and get to know about it. And this problem has so far no cure. There are some, surgical procedures are also there to people who suffer from very chronic Parkinson's when they cross over a span of years suffering from Parkinson's. But then they are not total cure again. They try to give the maximum relief. Innumerable number of research is going on with respect to the human brain, neuron cells, and many other components and chemicals produced within the brain by the brain cells and so on. And they are to study about the role of cerebrospinal fluid functions with respect to Parkinson's. Those studies will also come up later, and I'm sure and I'm hoping and I'm very, very confident that the modern science will come out with a very good cure for Parkinson's. At the moment, we are trying to deal with the symptoms of Parkinson's, trying to give relief to the patients by various techniques, pharmacological drugs, and little bit of surgical procedures here and there. But in the traditional science, Tamil science, it was called Nadukuvadam, and we do have very good treatment for Parkinson's. There are one or two medicines are there which can help us a lot with respect to Parkinson's. And as far as the food and nutrition is concerned, when you get into Parkinson's, we should avoid the animal protein, especially the animal protein. And also, you should identify and reduce copper-rich food. This is very important. Secondly, the cluster beans, in Tamil it's called kottavarangai, the cluster beans. It has tremendous molecular potency to strengthen up our neurological structure of the body, and also it has a lot of potency, molecular potency to make your brain functions very good. So how am I to, use this cluster bean? that when I'm going to cook this cluster bean with the salt, I destroy most of the molecular potency of it. So what you do is, you take around 5 cluster bean, cut them into small pieces, put it in 500 ml of water, boil it, and then reduce it to 100 ml, and then you filter it and have it once or twice a day, half an hour before your breakfast and half an hour before your dinner. If you do this for 11 days, give a break of 3 days, because don't allow the body to memorize it. And you have a very good fat component in ghee, which is very, very important for our brain, cow ghee. And you can feel free to use a good amount of ghee in your daily food intake. And also coconut is one of the tremendous component for the human brain. But coconut has a limitation. When you break a coconut, the molecular potency remains only for 1 hour. So you break a coconut and then, take good amount of 100 grams of grated coconut, mix it maybe along with some sugar or jaggery something, and have it along with your breakfast every day. So every day you have to break a fresh coconut. And garlic. Garlic has a tremendous potency for the human brain. What you do is take 2-3 slices of garlic and then smash it, put it in a glass cup or whatever, and then smell it for 5 minutes, once in the morning and once in the evening, which gives you tremendous, potential function to the human brain. If these things, if you can practice along with 1 or 2 drop medicines that is there in the traditional sciences, you can feel very comfortable as far as the Parkinson's is concerned. And if you can approach us, we will tell you all the methodologies and how to use it, and how exactly to protect yourself from Parkinson's. Thank you very much. I wish this information will be very helpful to you. Goodbye, and see you in my next video. Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.